In December, we asked you to nominate the remarkable women in your life for some special recognition. We received many incredible nominations from all over KELOLAND. Now we've selected 4 finalists and are sharing their stories with you every Tuesday this March. Tonight, we introduce you to our next Remarkable Women nominee, Maddie Borah.
You want me to bring them forward? I can bring them forward.
Okay.
I love Fridays.
You'll find Maddie Borah at the W.H. Lyon Fairgrounds nearly every Friday, lending a hand at the Faith Temple food giveaway.
There's a deeper connection than just getting food. That it's about building, again, those relationships and having those conversations. We're short on wagon pullers, it appears.
Okay. Relational interactions. Maddie is helping to teach the next generation of nurses.
What my students are expected to do when they go out on Fridays is to come with an open heart and an open mind and a willingness to serve. Good morning, Laura.
Good morning.
Good to see you.
For the past 5 years, Maddie has taught dozens of students through public health clinicals every year.
My clients are indigent or uninsured. Some of my favorite clients are homeless. But that doesn't mean that they're not a person anymore. And I think they lose some of that humanness just due to their circumstances. And so making them understand that they're important and they're not just another patient on the docket, but that they really are a human being.
It's a population Maddie has worked with throughout her life in several different roles.
Through high school, I worked as a 911 dispatcher, jailer.
After spending many years at EMS, she went through fire training to become the first female to work for Sioux Falls Fire Rescue.
I miss firefighting a lot.
She spent most of her firefighting days working at the downtown fire station.
I loved working downtown because I got to work again with that population, and they just taught me so much about life and life on the streets. And that just really encouraged me to go on to nursing.
It just entails a little poke on the finger.
Doing okay through this whole COVID isolation.
Becoming a nurse brought her lifelong work with emergency services full circle.
I started in nursing school when I was on the fire department. I wanted to be the head of EMS.
But an injury took her off the fire department and onto the nursing floor at Avera McKinnon for nearly 15 years. But then a higher calling came along.
I'm actually a licensed pastor as well.
She now combines both callings as a faith community nurse.
Being a faith community nurse, you have that opportunity to actually build those relationships and work in areas of their life that sometimes get missed, like the socioeconomic or the spiritual or the emotional components that we don't necessarily address when we're trying to fix their acute illness.
Maddie is teaching future nurses how to care for more than a patient's emergent medical needs.
It's really about building relationships and getting to know that individual as opposed to just doing their blood pressure or just going through their med list. It's learning to be able to communicate on a deeper level than that.
Before the pandemic, Maddie and her students would have a free health assessment table set up at the food giveaway every Friday. Her students also spend a week living off of the food their patients receive at the giveaway.
So when you're trying to teach them about their new diagnoses or helping them to be more compliant with their diabetes, you now have real life experience that this is their food, and you can teach them in their realm of reality.
Growing up, our house was always the house that the neighbor kids came to. It didn't matter how many of us was there, she was like, who's eating?
Maddie's daughter Danielle says her mom's heart for helping comes from a deeper understanding.
Being a single mom, and I think it also came from being in a huge family. She's the youngest of 11. So I think growing up, I think she, it had to be hard.
There's a stigma that really settles in when you talk about poverty or those that are poor. It's so important for me to break that stigma that it could be you.
A compassionate heart for others that makes her truly remarkable.
I said my mom's a super easygoing woman. She's very warming and welcoming, and if you ever needed anything, just ask her. She would never tell you no.
You've done a lot for a lot of people.
She's helped quite a few folks all over KELOLAND. Maddie grew up near Ipswich, but has spent the past 30 years in the Sioux Falls area.